It's going live.
Okay.
I think we are live, and let me get TikTok on. Hi, everybody. Let me just get these guys on as well. Sorry, we're running a couple of minutes late. Hey, guys, so it's going to be 12 to 1 now on Mondays. We usually have a hard stop at 1. Today it'll be about 12:52 or 12:52 or 12:53. We got a hard stop, and let me put TikTok on as well. Okay. All right. Parham, how are you?
I'm doing good, man. Really grateful to be here with another week with you.
Yeah, likewise.
Yeah, it's something I look forward to on a weekly basis. So
yeah, this should be fun. And I'm gonna move this over here because I'm trying to focus on the thing. Hi guys, hi everybody. How are you doing? Thank you for joining us today. And this is actually the topic today. I think what is it? Over-the-counter medication abuse. Let me see. Can over-the-counter medication be abused? Hi, everybody on TikTok. We are on YouTube. Me and Parham Namatola. We are doing Can over-the-counter medication be abused? This is something I'm going to do much more in-depth videos on. But I think this is a great place where we bring Parham in. Again, we're on YouTube, Dr. B Addiction Recovery. Come on there, ask your questions. Hi, everybody. And I think this is an important topic. And the part that I think Parham can really contribute and get us to draw out and distill the concept of addiction and the spectrum of addiction, and how this really points out to the fact that it's so much more than here's a piece of heroin or cocaine or whatever, and it's addicting by some sort of innate property. That's true for a lot of substances, but the concept of addiction is so much more than that. Hi, Parham, how are you?
I'm doing really good, man. And yes, this is a very important topic to talk about anytime you're discussing addictions in general, because when you talk about addictions, there is a spectrum. And what a lot of people, think of, they think about the alcoholic that has the paper bag over the alcohol living under the bridge, or the heroin addict that has the needles, and they're shooting in their arms, or someone's smoking out of a foil or this and that. But there are a lot of human beings that actually use and abuse prescription medications. And when do they use and abuse those, by the way? When you take away their drug of choices from them. This is something in our field that I see happen a lot of times. I'm sure you've seen it too, with specific over-the-counter medications that people take to continue to get a little bit of relief from the anxiety, from the depression, from the chaos inside their mind that they're experiencing internally and externally. And they seek something that can give them a little bit of relief from that. And sometimes people get surprised when they hear what some of those medications are. However, they are commonly used and abused. And yes, they can lead to their own addictions on their own.
Yeah. And I'm even going to widen this issue. Can I go on for a couple of minutes, Power?
Oh, yeah. Feel free, man.
The idea sold, and we're going to get into specifics, and some of you might be shocked, and some of you are going to be like, oh crap, yeah, that's right. The idea of turning medicines over the counter, and keep in mind in some European and Middle Eastern countries, there is a certain degree of benzos and opiates like codeine that you can get over the counter. But I'm just going to talk about within our society and culture, the idea of turning a medication over the counter. The formal argument is sold as empowering the patient and encouraging self.
Doctor, real quick, I'm sorry, yeah, there you go. That's what I was going to let you know. Your little thing was falling over.
Off. Okay, I'll just
okay. That's even better.
Yeah, encouraging self-care and empowering the patient. That's the idea and the argument that you see often within the academic literature. But there's an old concept in legal theory is if you want to see why something happened, look at its effect or what somebody gained from it. And it's stated much more eloquently than that. Over the last 20 years, I've seen a major push for a lot of medications to go over the counter. And well, this increases sales. Okay, so that's number one. Number two, there's an idea here that the general public is sober-minded and educated and has enough self-awareness to deal with things in an appropriate manner and sort of an institute a safety mechanism for their own well-being. Well, that just isn't the case, okay? Because it just isn't, and that is not what is seen. So that being said, there's a few classes of these medications that are we see quite a bit of abuse, and I don't want to get into each individual one, at least in our society. My favorite is diphenhydramine, Benadryl. It's an H1 histamine receptor one, but the classes are basically anti-allergy medications, anti-diarrhea medications, anti-cough medications, and there's a couple of those, and I'm sure Powerhome's seen quite a few of those. And I'm going to say one other thing. I think the problem, we can look at the poison center statistics for ER visits. This is intentional use, but I don't think it really brings out the numbers, because I'm going to say this. Powerhome mentioned a group of people that are using this stuff for the reasons that he stated, basically intentional misuse and abuse right off the bat from other drugs. But I'm going to say, when you look at the data, it's the 18 to 25-year-olds. This stuff is probably affecting every age group to a large extent, probably the elderly. It's kept under, and we don't really have, even though there's some decent papers out there, we don't really have a grasp on it. And so when people ask me, hey, can you get addicted to Benadryl? You can. There is a potential for, not only is there a potential for misuse, abuse, serious side effects and harm, but you can have addiction and withdrawals. There's plenty of case reports out there. And I just kind of want to start off with that. And this really kind of brings out, and the other thing this discussion does, it really brings out the nature of addictive behavior and where we're at. I want to mention one thing, Powerhome, cocaine, right? If you open up any one of toxicology or addiction textbooks, it's considered as one of the most addicting substances that we have. But it's interesting when you look at the indigenous population of cocaine users, to the best that we can tell, except for a very small statistical margin, these people have been using it forever without the kind of abuse we see in Western society. Absolutely, we see people overusing it. We see issues with gums, teeth, and so on. But the kind of abuse that we see with these folks is just non-existent. And so I'm going to say there's an ingredient in our social milieu that pushes towards looking for relief, coping, sleep, anxiety, and so on. So I just kind of want to start it in that way.
Yeah, man, absolutely. And speaking of cocaine, there's, I know you know this, but in the early 1900s in the United States, cocaine was found over the counter in the various pharmacies you can go to. And some people might not know this, but the classification, when you look at like Novocaine and lidocaine and cocaine, they end with the same AINE. And those are usually painkillers of nerve endings, right? So even pharmaceutically, medicinally, these over-the-counter medications that sometimes could be illicit, there is some medicinal usages for them. It just, times have changed a little bit, and purity changes, and what they're cut up with changes. addiction level changes. But I'll tell you this, doctor talked about those 3 classifications. So doctor went really broad with it because of his expertise working with different people who are not just in the substance use and addiction treatment realm. But mine is a little bit more narrow, if you will, because that is the population that I have my most experience with. It's who I've worked with. So the abuse that I see does come from the exact same 3 classifications of medications the doctor talked about, which is the antihistamines, the Benadryl. People seriously abuse it for sleep. I mean, that's what I've seen is individuals taking it at very high dosages to be able to fall asleep. And if they don't take their Benadryl, doc, I've seen them have a very hard time falling asleep. So there is some addiction to, whether it's physical or psychological. The Imodium, which is the anti-diarrhea medications. Do you have any specific cases of seeing someone addict or abusing that medication purposefully? Just so people get an idea of the dosages we're talking about here.
Which one? Benadryl?
Well, no, Imodium, when anti-diarrhea medication, because I know it's abused. I see it in treatment all the time.
Yeah, I haven't seen it in a while. I've seen it a lot. I don't have enough of a feel to talk about dosing on that. I do have much more of a feel for Benadryl, but not for that one.
We'll go for Benadryl too. I'm just so people have an understanding if they have any loved ones that might
I've seen Benadryl 2, 4, 5, 600 milligrams a day. The case reports out there go up to 1 to 2,000 milligrams a day. And the way you would treat it and figure it out, they come in with psychosis, all this stuff. But the way you kind of diagnose and treat is IV 50 milligrams of Benadryl. And then you start some sort of a protocol taper over 3 to 4 days. But Benadryl, I've seen 500-600 a day. The literature reports, in case reports, up to 2,000 milligrams a day, I believe was the last one I saw.
Yeah, and so just so people have a scale of that, Benadryl is usually a 10 or 20 milligram pill, right?
So Benadryl is 25 to
25. Okay, there you go. So just for scale, what doctor just talked about, I want everyone to put that into consideration. If you're ever wondering, can over-the-counter medications cause addiction? That is not a starting out dose that someone's starting with. I'll tell you that. That is someone that has used consistently over an extended period of time. They have built the tolerance for it, which is one of the signs of physical dependence and addiction. So it absolutely can lead to that. And the last one, the classification, is the cough suppressant. So this one I see, often because a lot of times through the testing that is done at the various levels of care, we see it show up in the urine analysis, and it's the famous drug of DXM, which is in the cough suppressants, right? And this one, the reason why individuals use it, it is a younger age demographic. So I think you said 18 to 25. I do agree with that. Sometimes the younger, the 18, 19, 20-year-old ones. And the cough suppressant, it does give them some type of a hallucinogenic effect. It does give them some type of a kind of a just out of body almost experience that they get from a dissociative state from it based on how much they're abusing from it. And it's dangerous. It causes psychosis. I've seen an individual go into drug-induced psychosis over these cough suppressants. The dosages are very, very high, and I'm assuming it puts a lot of stress on various organs. Is that correct, Doc?
Yeah, it's they call it robotripping. Is that what it's called?
Yeah, robotripping. Yeah,
and it's interesting because dextromethorphan is you nailed it. It's actually a dissociative hallucinogenic, right? Yeah. It's like, okay, wow, okay. And it actually has quite a few different mechanisms. I think it works on the SS selective serotonin group, but certainly one of the big ones is it blocks NMDA receptors. And it's really... it's a dissociative and effects. We're talking the same thing as PCP, which, by the way, ketamine is in that same class. Different mechanisms with those two and DXM. But yes, you nailed it. They have sort of hallucinations and crap like that.
Yeah, and if someone's wondering why would someone want to take that, so if someone's purposely abusing a medication that helps them disassociate from themselves and reality, as a clinician, my question would be, what are you disassociating and what are you avoiding and what are you trying to get away from? Because see, one is the coping skill that they're using, which is the use of substances to get away from something. But the end result is they're trying to get away from psychological, emotional, potentially physical discomfort. They're trying to get a little bit of relief. And these things, when used over extended period of time, they do lead. I mean, have you seen anyone go through any type of drug-induced psychosis that's lasted a little bit because of the excessive amounts of DXM use? Have you seen it?
No, and the way I pick up things like DXM, I've only had one patient go into one of my earlier programs for DXM. But I'll tell you, Param, you might actually have a better acumen at picking these up. Most of the time, I don't even deal with stuff like this. And when I have a younger crowd, it usually comes out after we get to know each other that they also abuse this stuff. And the other group is elderly that might come to me for different things. And then we realize this kind of thing might be going on, usually antihistamines. And so I don't get it that honestly in the same way that you do. These often go under the radar, and I get hit with it.
You know what? I'll tell you where we see it, Doc, is also working with recovery communities, being associated to sober livings. A lot of times, these are medications that they can get away with using inside the home without anybody under the radar use. Mm-hmm. And it shows up in urine analysis if they're in some type of programming somewhere later on down the line. So a lot of people miss these when they're actually happening. And the other classification I know I'm curious about is inhalers, so dust off, those type of things, because they are over the counter. They're not medications, they're not OTC medications, but they are items that you can buy legally without a prescription, and people do abuse the heck out of those things.
So you brought up another good one. And,
inhalers.
Yep.
Inhalants.
Yeah, and it's I'm about to do a video of this, and it's really whippets is what they kids are calling it. It's extremely popular. The gas in that particular one as a class of inhalers, when we're talking, is nitrous oxide, which is one particular type of inhaler. It's called laughing gas. I believe it's still used to induce anesthesia. But here's the other thing about that one, which I'm happy to answer stuff on it. I'm trying to steer away from it. But the inhaler, here's the issue. This stuff causes serious damage, including some serious neuropathy. And, well, it's much more than neuropathy. We're talking about axonal degeneration within the classes of upper motor neuron diseases. I mean, people can get really messed up, and it's popular. And since you mentioned it, I don't get people coming in for that. So, and I'll tell you why. I do see it, and I used to see it, and I work a little bit less for some reason with a younger crowd, 18 to 25. In that crowd of hardcore addicts in that area, which I'm sure you see a lot more of, they're getting away with using this stuff, and that goes under the radar. But I'll tell you, I've seen the effects. It's profound. You're talking to a kid, and then he'll go and do that. It's a black hole what happened to him the last 5 minutes. He has no idea. And it's quite dramatic in its presentation.
Yeah, absolutely, man. It's scary actually to see because it's so disorganized and it's so scattered, and their mind is not working what we consider normal form of functioning, and it is short lasting. That's why they continue the use of that over and over and over and over again, and that alone, like you said, has a lot of nerve damage can happen. So someone wants to know if there's any damage lifelong mentality. So can it impact something lifelong?
Potentially. Look, all of these things can have a long term impact. Are we talking about nitric?
Yeah.
And I think I don't know how much robust literature we have attesting to that and saying, look, if you use this amount for this amount of time chronically, you're going to have lifelong brain damage, whatever that means. We have to be careful with labeling these things. We got to be cautious. It's difficult to conduct studies where I can formally say the data shows X, Y, and Z, but I certainly wouldn't want to be, look, methamphetamines are like taking a hammer to your brain. And someone just mentioned this P2P that I made a video on TikTok a few days ago, and it really is doing well. This stuff is toxic, and you hear people talking about the long-term damage. That being said, Parham, I am, and I'm not being dreamy or unrealistic about this. I have in fact, I wouldn't be doing what I'm doing if I did. I have a very strong position and belief that any issues can be overcome. Sometimes let's say if I wanted to be a pro basketball player, it's not going to happen, right? So you got to keep your feet on the ground, your head in the stars. What I mean by that, okay, you've been doing meth or inhalants for a while, and you just feel dumb afterwards now that you're clean and so forth, and you're like, wow, I wasted brain cells. Cognitive and neuropsychological rehab is possible, and you can always go a little bit further, take this with a grain of salt, than what us doctors tell you. And I say this from my own personal clinical experience of seeing large amounts of traumatic brain injury in my past life. And whether it's the neurosurgeon that didn't want to operate, or afterwards rehab, always telling people their outcomes are going to be much more poor than they often turned out to be. And I say that from that clinical experience. So, I'm always hesitant to answer that, Parham.
I didn't believe that there's any literature on it either, but the follow-up question, it was like, hey, doesn't it kill brain cells and they don't come back? I also believe, by the way, so is there some damage that happens to the brain because of substance abuse? Potentially, right? However, I am a big believer of brain plasticity. I'm a big believer that the brain it can heal in real time, and the brain not only can heal, it can get stronger. It can get new connections, stronger connections with a healthy lifestyle, active lifestyle, keeping the brain engaged, putting clean things in the body. I do believe that the resiliency of the human being, including the human brain, is something that is fascinating to us. And I believe in the possibility of human transformation. I say it every week. I really do believe in that. Yeah, I believe in that with the bottom of my heart. We have someone here on the chat that says in a clinic, and so it was something about, but the reason I want to shout this person out, Giannis, I believe. It says greetings from Greece. Now it's 10:30 p.m. in here. So hey, Giannis, thank you for logging on from Greece. That's really cool to have you here. I just like it when we have a diversity in our populations. It's just nice to see.
Am I still with you?
With me?
Oh yeah. Okay.
Yeah.
I'm sorry, Maisha. I'm trying to figure out how to get in there where I can read stuff with you.
On the side where it says private chat, then there's comments. You can go in the comment section.
Yeah, I'm not even. Let me enter. For some reason, I'm out. Oh yeah. Oops. Okay. Oh, we got Katie.
Cool. And then Johnny, final question, Johnny. Even after 25 years old, you're 28. Yes, even after 25 years old, people like Dr. B and myself believe that the brain can continue to heal and continue to develop. So 28, you're still young, really young, man. Even if you used a lot of whippets, at a younger age, and you're living a healthy lifestyle, the brain's a phenomenal and fascinating thing. So keep living a healthy lifestyle, and your brain's going to continue to.
Oh, shoot, I don't know why it's. And in fact, the data is pretty clear on that. I'm getting echo. Katie, we'll bring you on. Let me kill this echo.
You might have your YouTube page on or a Facebook page on or something like that.
Yep, I got two things on.
I'm solo. He's going to be right back, guys. Dr. B in technical difficulty. There he is. He's back. I knew it.
Okay. All right, Katie, hi. Let's bring you on. And someone real quick, asked about paroxetine on TikTok, and I think they were asking if you can have withdrawal. Yeah, it's a SSRI. You can have withdrawals, and some people have pretty bad ones. Hi, Katie. How are you?
Hi. So I just have a quick question. So I'm addicted to meth, and my doctor wants me to go on all these medications, and I'm like, I don't want medications. I just want a reason why I need to be off of it. And I haven't been able to find that reason, and I just wanted to know if you guys had any advice on that.
I got plenty, but I'm going to let Poundhome start off. He's way better at sifting through this kind of question than I am.
So, Katie, just to confirm what you said, first of all, thank you for calling in. And it takes a lot of courage to call in and kind of own where you are in life and what you're up to and you know what your day to day looks like. But I'll have a question for you. So, did you ask what you're looking for a reason to get off meth?
Well, okay, my reason is because I'm on probation.
Okay.
That's my reason. I have to get clean. And I can't get clean because I just don't want to because okay, so when I'm on meth, I feel like a normal person. When I'm not, I have depression, I have ADHD, I have bipolar, and so now they want me to go on all these medications of bipolar medication, ADHD medication, and depression medication. And I'm like, I don't want your medications. I've already tried the medications. Like, why should I go on the medications? And so I also don't know what's in those medications, so I don't know if I'm going to be allergic to them. I don't know if this, I don't know if that. So I'm like hesitant about going on medications, really. But see, when I was 6 years old, I have been on Adderall since I was 6, and I was on 150 milligrams of Adderall. And ever since I was 16, I stopped because I got pregnant. And so that was my reason for me to stop marijuana too. So that gave me a reason. My whole life, I've never really had a reason to do anything really with my life, and I still don't. But right now, I need a reason to be able to stop doing what I'm doing so I don't go to Yuma. from Tucson. So go to Yuma because that's when we got caught coming down from Oregon to Yuma to Tucson, and we got caught at Yuma with the dogs, and we went to jail for 6 days, and we just haven't been able to stop since.
Yeah. So thank you for sharing the whole, the background story. And I had an assumption that at some point in your life, prior to all the meth, you said there was some type of ADHD diagnosis, and there was some type of either Adderall, Ritalin, Vyvanse, something in your history.
Adderall.
Yeah. For some reason, I had that guess. But you said at 16 years old, you had your you got
first
pregnant.
Child. Yeah, I've been pregnant 3 times.
Okay. And are your children still a part of your life?
No, they've all been adopted with my family.
With your family, so they are around. They're safe. You know where they're at. I'm losing her a little bit.
Yeah, I am too. I really want her question answered because maybe we can jolt her into seeing this the right way.
Yeah. I think we lost her because
Did I lose?
Yeah, I think Katie. I think we're losing you for a sec.
Katie, let's take her off and bring her back on. Katie, try and pop back on, okay? Let me give it one shot here. If not, Katie, get off and then come back in.
I am losing you a little bit. Let's see.
Yeah, Katie, we're I will answer. Yeah, we're losing her. Do you want to just see if we can answer it offline?
Does that help?
Yeah, let's try and answer. Katie, you're totally breaking up. We're gonna try to answer this off with you all.
Please, Katie, please listen and listen because Dr. B is going to talk about the medication piece, and I'm going to talk a little bit about the reason piece right now. So just watch us. We're going to get you off, but watch us, okay? And then you can respond. There you go. So she was talking about looking for a reason. So I'm going to say this to everyone, not just for Katie. There are many human beings that come into the recovery world not because they are internally motivated, but because they are externally motivated. So in her case, the external motivation happens to be something called the Department of Probations. It happens to be a judge. It has to be a court order. She doesn't want this because she feels like more of herself. She feels comfortable. She feels more at peace when she's under the influence of a substance. And saying, hey, I don't want to let go of this only thing that's ever worked for me since I've been a child, since I've been an adolescent. This is the only way I can feel comfortable in my own skin. I don't want to let go of this, but they're making me let go of it. So I'm looking for a reason to let go. And I will say this, that unfortunately, that reason is not going to come directly from me. That reason, unfortunately, isn't going to come from Dr. B. The reason is going to come when it's an internal motivation. And sometimes the external motivation allows us to gain the space, the time, the change in perspective, the change in outlook, to be able for that internal motivation to show up and appear. Because the first internal motivation, I'll tell you this, if I want to give you a key or a tip, is you. You are the reason, right? There is nothing else besides yourself, your health, your mind, your body, your spirit, your soul. That is the reason, right? And I know it's hard to see that and feel that and connect to that when you're feeling a range of emotions. You talked about various previous diagnosis. I'm assuming there's potentially some type of life events, psychosocial, potentially trauma. There's a lot of stuff in there, loaded, packed up, that it's hard to see that main reason, but you're the reason. Later on, you talked about children that may or may not be in your life right now, finding out a way to heal that part of you that is disconnected from that, and maybe potentially having that be a part of your future, their future, could be a reason. Doing something in life you're passionate about, right? Outside of the drug use, surrounding yourself with people who care about you as a human being could be reasons. Leaving a legacy behind could be a reason. There's so many different things that we have in life that could be reasons, but your current perspective doesn't allow you to see that. And the part about medication, I'm going to pass it on to Dr. B, but those are just the fact that you're asking for, hey, what's the reason for me to get clean, get sober? That alone is a wonderful question to ask. That tells me that you're seeking, you're looking, and that's how people find things when they look, right? That's how we find things. So that's really going to help a lot of people out. There's already people saying they're in the same situation as Katie. There's a lot of people kind of having your back and talking to you. I hope you're reading the comments on the side to feel the support in our community. And Dr. B, so anything about the part about various clinicians, doctors, psychiatrists telling her to deal with her bipolar or deal with her ADHD or this and that through medication, the fear she has about what's in the medication, the fact that, in the past they haven't worked for her, or whatever she was talking about. Anything you want to talk about that? It was a great, thank you so much, Kay. You provided us a lot of great talking points that we could provide a lot of education.
Yeah, I'm going to actually jump a little bit into your area before I answer that and add a few things to what you said. I hope I'm still on TikTok here. It's looking weird. So my first observation, Katie, you seem like a really, really sweet gal and pleasant. I don't know how old you are. I don't know anything of your clinical history, but one of the things, and don't take any of this the wrong way. I want you to think about what I'm saying. You come on, and there's a kind of a casual air about it. Hey, give me a reason to quit. Everything's great. And so I have to ask you, what do you mean by give me a reason? And what I mean by that is when we talk about what is your reason for doing this, we're usually either referring to something in the external world or something within ourselves, and we're looking for something that is better or worse. Let's take a look at this, okay? Now, if you were going to tell me, well, I take half a gram of meth every single day, I don't have any consequences. And again, I don't know how long you've been using this stuff. I haven't had any consequences of using illegal substances and methamphetamines. And in fact, my life has progressed exactly in the way that I want to. Whether it's, I'd like to ask, are you trying to get off because they're telling you to? Well, how about, did you get in trouble because of the methamphetamines? Is the issue with your children related to methamphetamines? Are you where you wanted to be when you were 10 years old in life, in terms of job, relationship, finances, education, relationship with family and loved ones? And ask yourself, what role has using methamphetamine played in that? So it's either I'm either wrong and it's been really positive, or I'm wrong, I'm right and it's been negative. Now let's look at the positive side. Obviously, there's something, as Parham pointed out, that's there's some mental health considerations that need to be tossed around and again distilled. I'm sure there's got to be a history of chronic PTSD, which someone on here just mentioned chronic PTSD for other things. You mentioned attention span. You mentioned potential bipolar issues. And this methamphetamine seems to address a lot of those things. And let's just call it what it is. That's a positive thing, right? We don't do anything we don't want to do because it mitigates something. And also, Parham, I think, pointed out, with the depression and anxiety, I don't know, maybe you're using the meth to hide or cope with shit that happened 5, 10, 15, 20 years ago. All right. So we got some positives. We got some negatives. Okay. You have to, now we get into the heart of what Parham says. You have to do that accounting. And you have to get to a place where there's intellectual and emotional honesty with yourself, and really look at, well, this is where I am now. Do I want to be in this way 5 years, 10 years, 15 years? So that's the part I want to add to Parham. Now let's get to the medication. You mentioned this outrageous dose of Adderall when you were 6, which, I don't know if you're referring to the 6 years of age later or so forth. So you've had problems. I'm going to wrap it up in a big picture, and hopefully I'm right. You've had problems being put on the correct medication to manage all of your issues, including mood, emotions, and productivity. Okay. That is solvable. And some of the reasons you gave, well, what if I have a reaction to that? That question is sort of I call it almost magical thinking or cognitive dissonance, because in some ways, well, you're using meth that you don't know what's going to be in there and it could kill you, right? But the idea of side effect of medications, all of those things with a little bit of work and the right doctor that keeps a very close eye on you can be adjusted, addressed, and changed without any shame, without any judgment. Takes a little bit of time. Meth kind of steals the propensity to use delayed gratification. You have to rewire and restructure everything. I suspect there's quite a bit of pain as well with the children, unless if you are some sort of a sociopath or a narcissist or something. But, and I think you're shoving that down and hiding from that issue as well. Look, you seem very young. You seem extremely sweet. I want you to take a moment, meditate on what we have just said. Come back and tell us tomorrow, next week, every week. Where is that accounting ending up? Find yourself a good doctor that works with you. Find yourself a strong therapist, because mental health, using someone like Parham and all of these guys gives you a lot of bang for your buck for methamphetamine stimulant abuse, and move forward from there. And that's my 2 cents on that, Parham.
Yeah, no, that was phenomenal, Doc. I mean, I couldn't actually say it better myself. And I hope you heard that. I really do. I mean, you called in to get some feedback and advice, and a very, prominent physician and, and a clinician that just joins this show every week.
Oh, you're much better than that.
They let you know what needs to happen. to that simple question of yours is, hey, give me a reason. There's much, much, much more layers to that. And to deal with, it's not going to be an easy road. I'll promise you that. However, the discomfort you're going to go through is going to lead you to breakthroughs and ultimately lead you to healing, which is something you absolutely need to do for yourself in your life. And I think that's why you're here, and you know that. And yeah, my hope for you is actually, I'm going to keep you in my thoughts and my prayers for this next week. And hopefully you come back next week and let us know what that accounting looked like of the pros and cons of using, and what are some reasons that you came up with yourself, you know, so it would be something to, I look forward to it.
Oh, here I am. Yes, likewise. Anything else on here, Param? Sorry, guys. I think I lost connection for a while. Okay. Yeah, that was a great question, actually.
Yeah, absolutely.
Let me look on here. We got a few minutes left, guys, and maybe we should start 11:30 on Mondays, Param.
I can do that.
So we can answer more questions, because these are very good, lively things. Hey, guys, I'm sorry, on TikTok we went off for a while there. Let me look on here. And, you know, no one's asking. Maybe this will be all for the video. You know, Benadryl, Parham, to me is a huge problem. I just looked at some data a few days ago covering Benadryl abuse from 2005 to 2016. It was a great review paper, and this stuff is quite consequential and has a profound effect on folks. I feel really bad I got off this. Do you see anything you want to answer here?
No, there was just a lot of support for her. Some people sharing, you know, what they're going through, or how, you know, the journey they went through to get there, talking about every path is different. Just a lot of support in the community. Kind of our major theme is. So it's yeah, if anybody has any questions they want to have for us, we're here for a little bit longer. Feel free to click on the link and pop up here. Oh, here's a question. This is actually good for, yep, that's exactly what I was going to go on.
Yeah. Hi, Debbie. This is a little bit, quite a bit up my alley, because I've treated so many of these and people that ended up needing transplant. Look, Tylenol is a fantastic drug. Okay. But again, we go back to what I pointed out earlier. We are not a responsible adult behaving society. I believe it's the number one, and I don't quote me on this, reason for liver failure or transplants out there. And here's what the issue is. You need to take Tylenol in the appropriate doses. Okay, used to be 4,000 milligrams. It's on there's a nomogram that you follow, and now they've brought it down to 3,000. And I don't know if there's data backing that up. Here's my point: you can have acute Tylenol toxicity. That often happens, and I think the number is 10,000 milligrams, where you start to get really worried when someone's trying to overdose. But when you get in someone with chronic pain, or the elderly, or any kind of limitations under liver processing, you can have acute on chronic, and it's takes a little bit of a skill to read the labs when these folks come in. The end stage of messing with Tylenol, which is called acetaminophen, is liver failure. Okay. And this is not a small matter, and it does cost society quite a bit. So the only thing I can say is understand how much Tylenol you are allowed to take during the day. And if you have any concerns about you not being a normal person, please talk to your doctor, because some folks might have problems with her liver, or decreased liver functioning as it is, and they will have to take less Tylenol during the day. I think that was the question.
Yeah, and you know where I've seen this, Debbie, great question. Where I've seen this in the addiction treatment world that people, individuals that are using or abusing at high doses Tylenol by themselves don't end up in the addiction treatment world. They end up in hospitals, which Dr. B's talking about. But it would be the individuals who are using things like Norcos, Vicodins, Percocets that also have Tylenol in them, right, Doc? So it's a combination. So and they're taking it to get messed up, right? They're taking an opiate medication that has Tylenol in it, but they're taking high quantities, right? They're taking those, so it's surpassing that ceiling of 3,000 milligrams of Tylenol per day for it to be like a fatal dose to your liver. I mean, they're going excessive amounts of that, taking 20 pills a day, and not doing it, for a day or two. That's like their dose that they're dependent on, and that's where we see a lot. I'm correct about that, right, Doc?
Oh yeah. You do see that, and the only reason these folks even get away with it is their age. And liver is a really robust organ in terms of regeneration, and it has stages of going to crap. Fatty liver, stage 1, right? And then you start to get into fibrosis, necrosis, and eventually you get decreased liver functioning. It's such a interesting physiological piece of machinery, and these kids actually get away with it sometimes, Parham, because they're so young, and they get away. But yep, you nailed it. It's another place where this kind of crap happens.
And here's Gen B. Just put that last comment on. We can't give specific advice here, but it's a good question to give some general advice. So, hello, that previous question about Debbie, that was a perfect, and I'm going to add to Debbie's question. I have lived with chronic pain for almost 9 years. I know that's your specialty over there, Doc, but which has made my body very dependent on Norco. I want to get off. So without knowing, Jen, without you coming on here and talking to give some general advice, without knowing your age, background, your history, why you got all that kind of stuff, we can't, in any type of professional capacity, give any type of guidance, feedback, information. But for someone that wants to get off something like a Norco, Doc, what is the typical, maybe not Jen, maybe not directly for you, but the typical route that they need to explore?
Yeah, so with Jen, the first question would be, her age and a lot of individual demographics. But what is the root cause of the chronic pain? Let's sort that out and get an understanding with what it is that she has to live with. Can it be improved? While we deal with the medication, I always like to change people's perspective. In our particular society, again, because of the way socioeconomics has evolved, most of the most reasonable people on the planet don't look at chronic pain as, hey, I need this resolved now. They look at living with a certain degree of pain and increasing their quality of life. In fact, I think, Parham, the recommendations here are, after 6 months of chronic pain, you need to be on an SSRI because you get depressed. So while we're working on the medication, I would get Jen to sort of change her perspective on the pain, whatever that would be. And then, you want to look at what's going on with the Norco. Is she on too much? Has the dose been increasing? Is she building a tolerance? Is it having negative sedating euphoric effect on her that she doesn't like? And finally, I would really explore, which I'm a really big fan of, is can you, Jen, make this switch to low dose buprenorphine products, Suboxone products, agonist, antagonist products, keep that at a low dose and start working on, I don't like to use this word, but I'm going to say the more holistic approach to whatever your pain issue is. And I find that quite often this really addresses the issue and gives people quality of life. Of course, there's the technical particulars if you go down that road of getting you off of the Norco. And I still find many doctors are not familiar with the idea or even open to it. And that's not because I'm a quack. That's because they're not familiar with the literature and the way this stuff is supposed to go. And if we did that, we might not have had the opiate epidemic, partly to a great extent.
Yeah, that was wonderful. And Jen, I hope that was helpful. He said a lot of things that were relevant. And I do have a hard pass here, but Doc, she did add that she's 50, white, gastric bypass with a major complication. And she did say yes to building a tolerance. So she's building a tolerance on the Norco now is kind of where she was at. So Jen, please listen to what doctor said there. Meet with your doctor. Yeah, she said, thank you so much. So yeah, meet with your own physician and kind of get your own care team intact and kind of let them know what your thoughts, ideas are, what your reasoning is. Kind of continue the conversation, come back and let us know how it went. Let Dr. B know how it went, because obviously he was invested in kind of giving you some very professional and then very accurate, in my perception, guidance and feedback. And that would be really cool. So, Doc, I do got to leave today, unfortunately, at this time.
Yeah, it sucks. I got to go to the clinic. Today's my one day there. And maybe we should start a little bit earlier. TikTok, guys, I'm sorry I got off. Powerhome has to go. But maybe we should start a little earlier because I want to get folks on so they can express themselves. And I like we've been having really good conversations. Get out of here. I know you got to go.
Okay. Yeah. So next week, let's do 11:30 p.m. Pacific Standard Time until 1 p.m. Pacific Standard Time.
And I do have some videos coming out on some of these medications that we discuss. I suck. I can't get things out on time. Please please subscribe to our channel. And everybody out there, do consider a Patreon. It really helps us support this. Right now, it's all funded out of our own pockets. And this is Powerhome and I's time. And we don't get paid for this. Powerhome, love you, man. Thank you.
Thank you, man. Appreciate it. Take care, everyone. Looking forward to seeing you back next week, 11:30 p.m. Pacific Standard Time.
Okay.
Right.
Bye, Powerhome. Bye, guys. TikTok, same with you guys. Get on the YouTube. I'm sorry, I don't know why today the connection is kind of funky. Hi, Champagne. And I want to get you guys on the channel. Ask whatever you want. We're going to do it next week at 11:30. Dr. B Addiction Recovery YouTube. Yeah, go on there and let's hope I get some videos cranking out. For those of you, since I have some of you on here, for those of you that saw the last video that's up there right now on methamphetamines, I'm going to do a little something on YouTube for that one to broaden the discussion. There's quite a bit of odd criticism on there. And they'll say something like, hey, you're an idiot, that stuff's been forever. Well, look at the video. It's a minute long, and I say, hey, this stuff is not new, it's been around forever. But I think I'm going to do a YouTube video anyway. Guys, love you guys. See you soon. Stay connected and be safe out there. Peace.